There are several ways to test for Mycoplasma hyopneumoniae, and knowing which method is right for the job is key. In this video, we'll be going over how to take a bronchial lavage post-mortem. But before we dive into the step-by-step walkthrough, let's take a look at the equipment and supplies we'll need: surgical scissors, a syringe, saline solution, and a tube. For the best chance at a clean sample, make sure you have the following supplies: personal protective equipment, a permanent marker, disinfectant wipes, a trash bag, storage bags for samples, a cooler, ice packs, a submission form, and mailing and packaging materials. If your goal is to confirm whether or not there is an outbreak, a bronchial lavage is a great way to confirm this, as it doesn't require a large sample size from your herd. Move carcass to a surgical table if available, or an area that's clear of contaminants. After necropsy, the entire respiratory tract is separated from the carcass, from the larynx to the lungs. Once the entire respiratory system, called the pluck, is removed, set the pluck on a clean, flat surface, with the front of the lungs facing toward you. Identify the trachea. It's the air tube running from the larynx to the lungs. Follow the trachea down, or where the trachea splits into two pipes is where to make the cut. Fill a 30 to 35 milliliter syringe with 20 milliliters of saline solution. Insert the solution into the lungs, covering the bronchus with your thumb immediately afterward so the solution doesn't leak out. From there, massage the solution into the lungs for 5 seconds. Then collect the sample by squeezing the lung directly into a 15 milliliter sterile tube until it reaches 2 milliliters of solution. Secure the lid and label the tube. Fill out the submission form for that pig sample. If you have multiple pigs to test, discard the pluck and use disinfecting wipes to clean all tools that will be used on the next group of pigs. Anything that could possibly contaminate the sampling from one pig to the next must be replaced or cleaned. Once you are finished collecting all your samples, secure the tubes in the cooler with enough ice packs to maintain a temperature between 32 and 40 degrees Fahrenheit, or 0 and 4 degrees Celsius. Secure lid on the cooler with packing tape, include a completed submission form, and the appropriate mailing information. You can view more videos on proper Mycoplasma hyopneumoniae testing in its various forms on the Boehringer Ingelheim Swine Health YouTube page.